A new poll shows what the most popular healthcare plan in America would actually be. What would it be? Turns out it would be Medicare-for-all. Awesome. Now, according to a poll by the Kaiser Family Foundation, that's a nonpartisan health policy think tank, they found that 59% of Americans now support Medicare-for-all. Now, this is the program, this is the plan made by Senator Bernie Sanders during the 2016 campaign, and currently has several co-sponsors for it. Now, interestingly enough, let me break this down by the numbers. Support for the idea split along party lines, with 36% of Republicans in favor of a Medicare-for-all option. Medicare-for-all system. Now, there is an option for Medicare. I'll get into that in a minute. Now, 59% of respondents supported a Medicare-for-all healthcare system in which Americans would get coverage through a government program like Medicare or Medicaid. Now, I have to note that the Bernie Sanders program actually would expand Medicare to cover things like vision and dental, so it would actually be much more comprehensive. Wonderful. That's actually awesome. Now, there is another plan, of course, that's being floated by some centrist Democrats. That is a public option. Now, how does that poll? Well, about 75% of the public would favor a program framed as a public option for anybody who wants it. Now, again, seems to be very, very popular. I think that's a little too incrementalist. I think that we actually need to go bold and progressive. But nonetheless, probably might be a little bit better than what we have, but it wouldn't actually fix the underlying problems in our current healthcare system. Nonetheless, let's get more details here. Now, on the Medicare-for-all plan, this is the Bernie Sanders plan, 75% of Democrats, so 3/4 of Democrats are like, yes, Medicare-for-all, let's go already. That seems to be a very popular issue among Democrats. I wonder why more Democrats are not actually backing this. More Democrats aren't saying, you know what, I should go with the majority of my voters and actually support a Medicare-for-all system. Well, there might be a couple of reasons for that I think you and I can actually easily think of. And that would be the fact that the Democratic Party doesn't necessarily represent its constituents, doesn't actually represent its voters. And I give you numbers on that. First of all, 58% of independents support Medicare-for-all, but only 36% of Republicans, as I mentioned before. Now, who do the Democrats continue to try to recruit to their side? Oh, right, that would be Republicans. In fact, their idea is, let's go more centrist, let's go more right-wing, so we can try and get some of the Republicans who are anti-Trump on our side. So that's the whole Clinton plan. And I believe it was Schumer that said, hey, man, for every progressive we lose, we gain some Republican voters. I don't think that was verbatim, but it was somewhere along that line. For every blue-collar voter that we lose in western Pennsylvania, we gain 2 Republican voters in the suburbs. I believe that's how it goes. So obviously we see how that strategy worked out. It worked out very, very poorly, as those Republican voters still, guess what, voted Republican. Strange. Who could have seen that coming? Oh, right, pretty much everybody. Now, when asked about the optional expanded Medicare program, or Medicare for some, GOP voters jumped up to 64%. And of course, that is why the establishment Democrats are now trying to put forward that plan. I mean, this is basically part of the plan put out by the Center for American Progress. So Neartan is like, okay, fine. We're going to put out, I guess, a public option, a kind of a Medicare for some, but not really Medicare for all. It's not really single payer. It's not really universal health care. It's just, it's a little bit better. It's a little bit better than what we have. Here, progress. Now support us, progressives. No, look, it's not bold. It is better, yes, But again, it does not fix the underlying issues of the fact that we don't have any sort of price controls, the fact that premiums continue to rise because of private corporations basically controlling the healthcare system for profit. You can't have a system that is for profit and have lower costs. This is actually going to cost more for the government if we do a public option. Now, if you want to say, look, I understand that, but maybe this is a good stepping stone. Okay, perhaps. But that's only if we continue to push forward towards doing a real, actual single-payer Medicare-for-all system. Once that public option, I guess, catches on to popularity. But again, I'm always afraid that when we do incremental little baby steps, we just do the first step, and then the establishment says, well, mission accomplished. We don't have to move any forward now. We don't have to actually move forward on this at all right now. Let's just leave that for the future. Well, how far in the future are we going to wait? 10 years, 20 years, 30 years, 50 years? Again, this goes back to, I believe, Dianne Feinstein when she said, oh, I'm just not there on Medicare for all yet. Well, when are you going to be there? You're already ancient. You're a dinosaur. When are you going to be ready? Probably not in your lifetime. You're never going to be ready for Medicare for all. That's what I'm afraid this incremental step is actually going to do. The tranquilizing drug of gradualism. Well, let's not take that. I'm not interested in that. And we've got to convince the public to also get behind that. Again, most of them are like, oh, well, we'll take just a little bit of a baby step and that's fine. More people support it. And look, the reason that it bumps up in support is because more Republicans are saying, okay, yes, let's have an option. Let's have a public option. I think what we need to do as progressives is to lay out why Medicare for all is what we actually need to do. Now, that said, right, Kaiser said that it's not conclusive whether the same percentage of people would support a concrete piece of legislation, which includes either a Medicare for all or the Medicare for some plan. They said, quote, it is unclear how support levels would fare once each of these proposals became part of the larger public debate on healthcare in this country. Prior Kaiser Family Foundation surveys has found that the public's attitudes can be quite malleable, and some people could be convinced to change their position after hearing typical pro and con arguments that might come up in a national debate. Now, I don't think that's a bad thing at all. I think that that's a good thing because the public actually has an open mind. So you might hear some, good pro argument, a good argument against it. Okay, maybe I'm in favor of this and maybe I'm in favor of that. Like if everybody has the right kind of information on how much it's going to cost, what it's going to do, I think a lot of people or a majority of people will actually make a right decision and go for a bold Medicare for all system. So if you theoretically make that good argument on single payer and knock down the people that are against the single payer system, you could change those people's minds and we could actually have even more majority support. Now, for example, and they have polling to back this up. In 2017 Kaiser poll, people presented with arguments against a similar proposal became 13 to 21 percentage points less likely to support the idea, depending on the argument. However, people presented with arguments for Medicare for all types increased their support anywhere from 9 to 17 percentage points. So that's a similar range. So basically what you need to do is you need to frame the right argument. This is all about framing the issue. And I think fighting against some of the more conservative, centrist talking points. Now, if you make a good argument, for example, this actually helps small business. Small business wouldn't have to pay for health insurance benefits anymore. You wouldn't be tied to your job. That's actually a very popular position that was inside the ACA. Oh, you can still retain your health insurance if you leave your job. You still would have an option to have health insurance, so you're not tied down to your job. That's, again, a very popular position. That's something that you would have with a Medicare for all program. Not only that, but you could actually have the government be able to negotiate drug prices with drug manufacturers. That would vastly decrease the price of health insurance premiums. And look, under a Medicare-for-all system, you wouldn't have premiums, but it would vastly decrease the cost of healthcare. Now, of course, one of the arguments that people that are against the system is, oh, well, you know, you're going to have more taxes. Your taxes are going to be a little bit higher. Yet, those tax increases are actually small compared to what premium increases would actually be. So it ends up saving families money. I think there was a survey or a study on that during the 2016 election that found that families would actually save more under a Medicare-for-all plan, and yet there would be more things that would be actually covered. So I think if you make those sorts of arguments and you back them up with obviously data and facts and things like that, then I think people are more receptive to that. And it's going to be, look, you're probably not going to get a lot of Republicans on board. For those who are not on board with single payer, I don't think that there's an argument that you could make that would get some of those people on board until they have actually experienced that system. And then, of course, that system is vastly superior to what we have now because, look, everybody in the end, they want health care. They want good health care. Some of the Republicans that you're not going to get on your side is the people who don't believe that health care is a human right. And I've had conversations with those people, and we cannot agree on that. So I think leave them out of the conversation. Sad day for you. Majority of people do want a Medicare-for-all system, 59%. And look, progressives, this is a more progressive country. There are more Democrats. If only they were actually getting out to vote more often and not having, you know, voter suppression against them, and the people who are, you know, don't actually get out to vote that aren't interested. If they actually do get out, then we could have a Medicare-for-all system that would be beneficial to everybody. And look, even people on Medicare like Medicare. There is a reason that nearly every industrialized country, every modern country, has a system of single payer or something like single payer. It's because it actually works. And I think once people realize that it works and actually experience the benefits for themselves, I think that popularity number is going to shoot up. So it's just a message. It's just a matter of actually just doing it in the first place. And now that we have majority support, I mean, there's no reason that we can't push for doing that and actually use that as a midterm issue to get more support. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.